Hey, this is Danielle from Black Business Boom and Black Owned Nashville, and we are live with our industry expert in all things dermatology, Dr. Aleta Simmons of GetTheSkinE.com. Thank you so much for joining us, Aleta.
Thank you for having me.
Yes, I'm excited. Today we're going to be talking about cosmetic treatments for Black folks. And this is something that we don't talk about a lot in our community. We try to act like Black don't crack and we don't really need any enhancements. But I feel like it's a topic that we're starting to hear a lot more about, and I'm happy about it. I'm glad that it's not so much of a taboo topic. So let's get into it. Let's talk about, for you as a dermatologist, give us some tips on knowing when we may want to consider some cosmetic treatments, or what type of treatments we may want to consider for Black skin specifically.
So, the most common thing people come in for are dark spots. So, a cosmetic treatment that we use are chemical peels,
Mm.
but we also use that in combination with some topical medications, which I consider cosmetic because insurance companies consider those treatments cosmetic.
Mm.
But I feel like that needs to be changed because it affects people's day to day life and how they feel about themselves and their self esteem. So we start with topicals and transition to chemical peels if people are interested. There are lots of different brands out on the market. Some work better for brown skin than others. Um, and I see people on TikTok doing medical grade chemical
That's
peels
exactly
on
what I was just
themselves.
about to ask you. Is like, could we do our own chemical pills?
Don't do it because, and I say that because you can't fix something if it goes wrong. You want to go to someone who's going to be giving you treatments that if you have a side effect, they can attend to it. So if you're doing chemical peels at home and you call the dermatologist and they're like, we don't have an opening for 6 weeks or longer, then you may be stuck. And
Mm.
so you don't want to be in that predicament because anytime you do something to your skin, there's a side effect, and you want someone who can address that side effect. And with chemical peels, you can have scarring, further worsening of the dark spots. Some people, there was a recent young man who was burned by a chemical peel at like a med spa. So you want to make sure you are going to someone who has a medical license and knows what to do and can fix it if you have problems.
Okay, because I'm seeing a lot of like estheticians and, like you said, med spas now that are doing chemical pills. And I was wondering about, if those are good folks, because they typically can get you in a little faster, a little quicker. But you say go to a doctor.
Right. There, I would say, the ones at med spas or the estheticians are doing may not be medical grade. When I say medical
Mhm.
grade, I mean the ones that are prescribed by a physician.
Okay.
So you want to know, what type of peel they're using, what's in it, because you want to make sure you're not allergic to anything that may be in the peel. Uh,
Mm.
I've seen patients come back who one woman had a cherry peel, like an enzyme, and it burned her skin. So you want to make sure that you may not have any allergies or that, you can go to someone who can also fix the problem.
Somebody in the comments said, please do not do these TikTok suggestions. It is not good. Chemical pills can be great, but at the right percentage and the right procedure. I
Yeah.
love it. Okay, good to know. Because before you couldn't really get access to them. And so now it's a little bit more accessible for us to get that medical grade stuff. And so folks are trying to save money, trying to save time, and just do it themselves.
And that may segue us into fillers and Botox because people are also getting a hold to filler products
What?
online. Yes, and doing their own filler. And the thing with filler is it brings back volume where you may have lost volume. But you have to understand that the face has a lot of blood vessels. And we don't want filler in a blood vessel because it's going to occlude it. Right. So you want to go to someone, preferably a dermatologist or plastic surgeon, even some ear, nose, and throat doctors can do some of these cosmetic procedures because we know facial anatomy and we know what to avoid, and we know how to counsel you on side effects. But fillers can be a great way to add volume where you've had loss underneath the eyes, and along what we call the nasolabial folds around the mouth. It's natural and normal to, have these things happen, but some people don't like it. In the age of Zoom, people look at themselves more and they're like, what can I have fixed? So those are some of the things that Black people come to me about. But Black does crack and it does sag, right? So that sagging in the skin that we have, because we have loss of volume and bone structure with age, starting in your 30s is when you start to see it. You may need to see a plastic surgeon. So I would shout out Dr. Amaka. She's here in Nashville. But that sagging that we have in the skin, you may need to lift that skin up. And that's something that we don't do well with filler. We can address the volume, but that sagging skin needs to be tightened up.
Okay, so let's talk about a little bit more about fillers, because I know that's a question we've gotten quite a bit about fillers and what types we should use. So any suggestions on the type of fillers? Are there any that you feel like for Black people work a little bit better, or is it kind of just across the board that they work pretty well for all skin?
So the most common types of filler have hyaluronic acid in them. You've probably seen a lot of products with that in there. Mm-hmm. And what hyaluronic acid does, it attracts water to it. So after your injections, a couple weeks after, you're going to see the full effect of that water being drawn into the product to create that fullness. So there are lots of products out on the market. So when you see your dermatologist, they can talk to you about which product is going to be best for which area of your face. There's Juvederm, Radiesse, Restylane. So those products can be picked or chosen based on what you desire to improve.
I love it. And someone asked, what about collagen loss in the neck? Are there cosmetic procedures that can help with that?
Now, I think they're probably referring to the loose skin around the neck. Mm-hmm. And so the best thing for loose skin would be to see a plastic surgeon. We have Kybella, which is for patients who have more fat. We call it submental fat in this area. Mm-hmm. And it can dissolve the fat. It's FDA approved for that. We can also use it in other areas for small fat reduction, but it's approved for that submental fat underneath the chin. If you want it tight, well, I will go back to say, if you want it tight and it's not significantly loose, micro needling radio frequency lasers can help.
Okay.
So laser therapy is another thing that can help tighten the skin if you haven't gotten to the point where you need a plastic surgeon. Okay,
and they just clarified that it's just wrinkled. So they probably are starting to see some looseness. It sounds like that's causing some wrinkles.
Mm-hmm. And sometimes for the lines on the neck, we'll do Botox because there's a very, very thin muscle that runs from a little bit below your clavicle all the way up to about here. And when that muscle tightens, just like the muscles on your face, it relaxes it to decrease those rings. So Botox relaxes muscles to decrease the appearance of wrinkles.
I love it. Now, as someone just said, I want some of everything. I love laser therapy. And that was what my next question was around laser, because that's another one that I feel like for Black people, we have to be very careful. And I'm in like several groups on Facebook where the topic comes up and folks have had bad experiences with laser. My question is, we know that there are certain lasers that are better for Black skin, and we trust certain people to do things on Black skin more than others. And I've heard horror stories from, years ago when like laser hair removal really became popular, where Black women got burned and other things. So have all of the lasers evolved at this point, or do we still need to be very careful as Black women when we're doing some sort of laser therapy?
You still need to be careful. Who is doing your laser matters. So you want to go to a board certified dermatologist, plastic surgeon, who've been trained in using these lasers and knowing the nuances of how to treat brown skin, because inflammation occurs, like I said, anytime we do anything to the skin. So you want somebody who's able to adjust the settings for your skin, test out what's going to be helpful for you to minimize any side effects, and be able to sit down and talk to you before you have the laser treatment on what to expect and what happens if you have an unwanted side effect. So you want to be fully educated on the type of laser that they're going to use, what your expectations are going to be, and what your subsequent treatment plan will be.
Okay, fantastic. That's good to know. Again, in my mind, I'm like, they should really have this together by now. Like it really should be like, laser's been going on for 10 plus years at this point. I feel like at this point they should know how to treat black skin pretty much anywhere, but apparently we're still dealing with the same issues.
Yeah.
Okay, so when we talk about cosmetic treatments, I know there are always new innovative things on the market. Anything that you want to share with us that we may not know about, any treatments that we may want to consider or think about as we're aging, or for any other issues that we may experience, that there may be something new out that we're not thinking about or don't know about?
So one new thing, it's been out for a few years, but not a lot of people do it yet, are PDO threads. They're actually threads that are placed in the face to give you that facelift appearance without actually having to go through the surgery. So some patients are like, I don't want to do a surgery. What's the least thing I can do to my skin? And that may be another option for people who may not want to be put to sleep and go under the knife per se.
Okay, tell me how that works. It sounds scary, but how does that work?
I mean, it's basically a thread that's underneath the skin, and so it's done.
Is it like an injection?
Not an injection, but actually placing the thread in the skin, and with the thread you can kind of lift to get the effect that you want.
Oh my God.
So yeah, it's something that's actually in the skin.
Okay. And what about PRP treatments?
PRP treatments are something that can kind of give you a nice glow. So first we take a blood sample. We take that blood, put it in a centrifuge to get that platelet-rich plasma. They call it liquid gold. That's extracted out, and you can have microneedling done, and then it be rubbed onto your skin. But there are some instances where you can have it injected onto the face to kind of give you more of a glow. We also do PRP on the scalp for certain types of hair loss. It doesn't help in all types of hair loss, but there are some areas, like some people with male pattern or female pattern hair loss, that may respond to it. The downside is we don't know how someone's going to react to it, if it's going to be helpful or not. So the treatments can be pricey, but for patients who want to try it, it's a good option if you want to try it and put forth that investment.
Yeah, I learned recently that they're doing PRP as like a breast lift option. They're now like doing an injection that can give you some volume here in your cleavage.
I have not heard that.
Yeah. I forget what it's called. A vampire breast lift is what it's called. Wow. Okay. Yeah, I love technology. It's put us right along. Couple questions that we have. Are there any at-home treatments that you can recommend? So we talked about like chemical pills and other things that can give you a little bit of a glow, but are there things that you feel like we can be using at home that are fairly safe for us?
Depends on what you want it for. Mm-hmm. So if they can drop in the chat, what the goal would be, I can better answer that question.
Okay, fantastic. And then any thoughts on microcurrent facial toning devices like the NuFace?
I don't know if I've heard of the NuFace. Is that with an esthetician? But I know they do the radio frequency, the wands.
That's what I'm thinking it sounds like.
That's what it sounds like.
Yeah. Any thoughts on
like a Hydrafacial? I do love a Hydrafacial.
Okay. Yeah, I tried to pull it up real quick, But yeah, it apparently uses some sort of currents that help to tone the face.
Yeah, we don't use those as medical treatments in dermatology.
Yeah, from what I'm seeing on Google right now, it looks like they are at home devices. So that's probably why you haven't heard of.
Right.
So it's something that we would use at home. I'll tell you this, they got good reviews on Google. So yeah, she said that you do it at home. Okay. Hmm, okay.
Good to know.
And the person that asked about things we could be doing at home was asking about tightening the skin on the face and neck. Are there things that we could be doing at home?
I don't know anything topically that you could do at home that's going to give you the effect that you would desire.
Yeah, that's always the concern. You know, when we see
Mhm.
these commercials and they're like, in 3 days, you're going to see these magical results.
Listen, there would be no Sephora, no Ulta if there was a magical cream to fix any of that, because we would need all of those other creams. They would not be on the shelf because that one cream that worked would take off and they would have their own website in their own store and everybody would just buy that.
I mean, very true. Yeah, I'm like, oh God, it would be nice. You know, again, we see the commercials and they're like, you know, use this and in 3 days you're gonna see these magical results. And I've used several and
Yes.
results have not been magical. A couple other questions. Is it okay to get your face threaded to remove peach fuzz? I
As long as
see
you
a
don't have
lot
a
of people
problem,
use the what's the little scrubber, the little thing that you
like a
use.
blade.
There you go.
The same blades people used to use to do their
Your
eyebrows back in
eyebrows.
the day.
Yeah.
I'm fine with threading as long as it doesn't give you any adverse effects. You know, people. You know, threading has been around for probably centuries.
Yeah, yeah. Okay. We got a lot of questions today. This is good. What about Retina? So I don't know I think that's the same person on LinkedIn that was asking about tightening the face
Hmm.
skin. So do you think Retina may be something they could start to use to see some sort of effect at some point?
I love Retina. Retina is also tretinoin. People may know that generic name, but I think it works great for lots of different things, especially anti-aging. Since we're talking about cosmetic treatments, it helps with dark spots. It's going to, I call it like a peel in a bottle because it's
Mhm.
going to help, brighten your skin. It does help with, probably like minimal tightening when you use it with other products. Like while you're getting your Botox to relax your lines, you also use Retin-A to kind of
Mhm.
help decrease those fine lines and wrinkles because it's helping with skin turnover and the things that we want to help support our skin to look young and healthy.
Okay, fantastic. And then we've talked about this a little bit before, but collagen. Someone asked, can you talk about collagen and do you recommend it to help with aging? And I know there are different ways you can get collagen through products or also like I put it in my smoothies. So any thoughts on using collagen for anti-aging?
So this is a big topic. We were actually discussing it in clinic with the nurses and the residents. Collagen, when we think about skin treatments, right? What you will want is something that you're putting on your skin to be able to get into the skin and actually have a function. Collagen is a big molecule and it may sit on your skin, but it actually penetrating your skin to do some work may not happen. So the effects that you may be getting from it may be from the topical as a whole. There are other things in it that are helpful, but the amount of collagen that is going into your skin to actually make you build collagen is not happening like it may be touted that it's happening. And
Mm,
even things that we drink or eat with collagen in them, when we eat or drink things, our body is going to break that down, right? So scientifically, you're thinking, if I eat this, what you would want it to do is go through your system and then pull out what it needs to go be building blocks in the skin, right? So you're not actually, drinking the collagen, and that collagen is actually going to your skin to do what it needs to do. It's kind of when we eat our fruits and vegetables, your body is going to break those things down and use what it needs to make what it needs to make. So your
oh,
body is going to make the collagen that it's supposed to make. So that may be up and down. There are some, benefits. There are some companies that have good products, but I would just be careful about what you're taking.
Somebody said hi, Barkley, and then he just came busting in the door. like he saw the comments on Facebook. Love it. This has been really great conversation. I'm really happy that we got to talk about this. I feel like I'm gonna have some questions. We're gonna have some follow-up questions that we're gonna talk about next month because there are just so many treatments these days, and even figuring out what's best for you and what you actually need can definitely be a struggle. And so we're very, very happy to have you come into us every month to give us advice and help us navigate having wonderful, beautiful skin and scalps and hair. I'm super excited. Now, tell folks what's the best way for them to reach you?
The best way to reach me is through my website, www.gettheskine.com. That's SKINE. Well, GETTHESKINE.
Gettheskine.com, and it should be in the caption as well. Yep, it is. So reach out to Dr. Aleta Simmons at gettheskine.com if you have further questions. If you're trying to find out how to book an appointment or get on her wait list, you can do that all at gettheskine.com. And we'll be back next month. I don't know what we'll be talking about, but if you have some questions or some ideas, drop it in the comments and we'll make sure that we come and take a look. And I'll also make sure that Dr. Simmons is tagged in the comments so that she can help and give you some more answers even after we finish up today. Again, thank you so much. This was fantastic. Again, it's something that it seems to be, and somebody asks, why is it such a taboo topic in the Black community? I don't know. Let's finish up. Tell me, what are your thoughts on that?
I think we try to live toward the standard of when people say Black don't crack, and that's stressful, right? Because we are going to age like everyone else is. It may be a slower process, and people may be ashamed to say, oh, I had treatment for my wrinkles, because we feel like we're not supposed to wrinkle. That doesn't happen, but it does. And so we either are going to embrace our natural aging, or some people are like, I don't like these wrinkles. I want something done about them. And that's okay.
And it is okay. I'm like, it is perfectly okay. And I think even if you're not concerned about aging, there are things that we just may not like about ourselves, and that's okay too. It's okay for you to go and get some things done. Like, I'm not really feeling this little area, and it's okay to get a little maintenance, So I love that we are able to have these conversations that are candid and open, and to let folks know that it is okay and it's nothing to be ashamed about or be embarrassed about either. So I truly appreciate you. Get on the waiting list. Someone says she's booked 2023. Get on the waiting list, and that'll be your way to find out if there are openings. So again, gettheskine.com. Go there and learn more about Dr. Simmons. Get on the waiting list, and you can also reach out to her and contact her with any questions there. Thanks so much, Dr. Simmons. We greatly appreciate you. Have a great day, and thanks for tuning in, everyone.